Estheti, makers of the leading brand TENA, has developed and presented a series of short webinars as a direct response to the global COVID-19 pandemic. Welcome to the presentation, Managing Incontinence During COVID-19 from Estheti, Canada. Today's agenda will include a background on who we are, our brands and partnerships, the COVID-19 pandemic and implication in Canadian long-term care homes, shifting gears, Estheti's response to the pandemic in supporting long-term care homes, from building an internal task force and determining needs, and then remodeling and adapting, what this looks like for the future, including newly developed modules, practice implications, and strengthening partnerships. And then finally, an opportunity for questions. So who is Estheti? Many of you will already be familiar with our brands. Examples include TENA and Jobst, and I will share more with you in the upcoming slides. Estheti is a leading global hygiene and health company dedicated to improving well-being through our products and solutions, essentials for everyday life. The name Estheti stems from the words essentials and necessities of life. Our sustainable business model creates value for people and nature. Estheti headquarters are in Stockholm, Sweden, with sales conducted in approximately 150 countries around the world. We have approximately 48,000 employees, with $12 billion in sales in 2016. Estheti also partners with United Nations Foundation in support of Sustainable Development Goals to improve hygiene, health and well-being worldwide, and in 2016 educated 2 million men, women, children and care providers. So as mentioned, here are our brands. TENA Incontinence products and solutions are the leading global brand. They are designed to positively impact quality care with added value services supported by clinical consulting and a best practice business approach. Leukoplast and Cudimed Wound Care offers a broad range of solutions in both acute and advanced wound care management, including alternatives to traditional antimicrobial dressings, such as our Cudimed Sorbact. The Jobst brand offers a range of compression solutions, from ready-to-wear compression stockings to short-stretch compression wraps that can be custom-made or trimmed to fit, known as our Faro Wrap solutions. And finally, our fraction management options, including ActiMove and Delta Cast, our orthopedic soft goods and physiotherapy solutions. So from a more local perspective, we can see here some of the partnerships that Estheti is engaged in here in Canada. In particular, BC Care Providers and the Canadian Association of Long-Term Care. Estheti's Director of Marketing summarised the partnership with her commentary. Estheti Canada is pleased to partner with the Canadian Association of Long-Term Care in a shared vision and commitment to raising awareness and bringing forward relevant healthcare topics that affect seniors across the country. TENA has been partnering with care homes across Canada for many years and providing high-quality products, service, and education around incontinence. It is exciting to see an entity that views the long-term care landscape in Canada through a national lens and that is aligned with the National Seniors Strategy. And other partnerships include that with Conestoga College. Specifically, much of our collaborative work with Conestoga will be highlighted throughout this presentation, as well as corporate sponsorships with the Canadian Continence Foundation, the Canadian Nurse Continence Advisors, the Ontario Long-Term Care Association, and the Canadian Gerontological Association, to name a few. So a little background about me. I'm a registered nurse both in the UK and Canada, with experience spanning 30 years in clinical settings, such as acute medicine, ER, elderly rehabilitation, and as a community-based continence advisor. I have a passion for improving the lives of individuals living with incontinence and sharing my knowledge with clinicians challenged with meeting the needs of sufferers. In 2020, I became an active board member of the Canadian Continence Foundation, and I have recently supported the Registered Nurses Association of Ontario as a panel member developing the updated best practice guideline for incontinence and constipation. I have been a team member at Estheti for over 10 years, and I became the clinical director 18 months ago. This role involves working with and supporting a team of clinicians that facilitate education in both advanced wound care and lymphology, as well as the continued development and delivery of continence care programs, services and education. I hold a post-registration diploma in nursing, a Bachelor of Science in nursing, and a master's degree in integrated health and social care. So let's first take a look at the COVID-19 pandemic impact in Canada. It's important to be aware that this is a very brief overview. I'm not an epidemiologist or a statistician, and I'm sure there are many presentations during the conference that can offer greater insights into the trajectory, the incidence, and the nature of COVID-19, way better than I can. The intent here is simply to set the stage. As infection rates and cases continue to evolve, we also need to be mindful of the rapidly changing figures and statistics of this pandemic. The representation here is a snapshot in time. Therefore, as of May 25th, 2020, there were 840 COVID outbreaks in long-term care homes across Canada that accounted for 80% of COVID-related deaths across Canada. 1 in 5 residents, or 18%, experienced COVID infection, with 35% deaths attributed to COVID infection in the long-term care population, as well as the infection staff. And this accounted for 10% infection rates for a total of 9 staff deaths. And this information is from the Canadian Institutes for Health Information. But it's also important to be aware and to be mindful that there are variations across countries in relation to reporting, and certainly differing meanings and variations across provinces and our territories that makes interpretation of the information challenging. So again, a few graphics that offer further reflection. Current data is available from the Public Health Agency of Canada, and it is fluid. This specific snapshot in time was accurate as of August 24th, 2020. As of that date, there had been approximately 124,000 reported cases across Canada, with approximately 5,000 reported in British Columbia. And as of the same date, there had been approximately 60,000 reported cases in Quebec and 40,000 in Ontario. Again, the intent is not to directly compare, simply to reflect on the impact. So the presentation today therefore aims to guide you through the response in part that Estheti played in supporting our long-term care customers from a distance. And the impact terminology is important, as throughout this critical time there have been people across our organisation, both globally and locally, working hand in hand to support customers in all areas of our business. Examples include converting lines that normally manufacture briefs into ones that will quickly produce face masks, digital platforms developed to support direct ordering of custom garments on the medical side of our business, and touchless measuring programs that are under development, to name a few. So this work, while demonstrating the supportive service to the long-term care sector, represents only a small percentage of the work Estheti does collectively to serve our partners. So the focus today is a representation of the TENA brand and the services. When COVID-19 started to impact long-term care, we identified some specific challenges. In particular, access to our traditional methods of TENA and incontinence-related education and learning approaches, and the changes to frontline care provider logistics. To address these challenges, we built an internal task force and subsequently developed and presented a series of short webinars in direct response to the pandemic. And I'll share with you now the steps we took to achieve this. So as a starting point, let's reflect on the traditional way of working. The normal or traditional way of working prior to COVID was in essence structured around meeting the contractual agreements with individual long-term care customers. This means meetings are customised and structured to meet the unique needs and challenges of each individual long-term care home or residence. Education Service and product choices are evaluated through face-to-face business review meetings and subsequent changes and actions taken based on this evaluation. That process has not changed. The value of service and attention to detail continues. Simply the transmission of information and delivery has changed. As I've already mentioned, as COVID and lockdown began to impact our long-term care homes in Canada, we knew very early on that we needed to find ways to support our long-term care customers. We also understood that needs potentially were different across the country. Resources were and continue to be impacted, including staff resources. Approaches to care were being adjusted. Different personnel pulled in to provide care services, often without previous knowledge of care practices. Understanding this determined our why and our rationale, if you will, and led us to establish a task force. Using an analytical approach, the team were able to consider who might benefit in terms of who was our target audience. To demonstrate our progression, this slide represents the process plan of how the task force evolved, considering a specific focus, the what, if you will, in terms of needs, as well as reviewing our existing portfolio of materials and which pieces were the most important and relevant. And then finally, commitment to establishing timelines and when we would execute the delivery of education. So our task force was a national team that consisted of a variety of experienced individuals working together to build out the plan. This team were from the Western, Central and Quebec regions, with of course myself and the long-term care channel marketing manager for continence care. The individuals engaged in the team brought a variety of experience and skills from sales, marketing and nursing backgrounds, as well as a regional specific experience. Collectively, the team brought approximately 60 years of working together in industry partnerships within the long-term care sector. And these individuals included Pam Lee, Key Account Manager, Tanya Colella, Long-Term Care Channel Manager, Colleen MacDonald, Account Manager, Sophie Michaud, Account Manager, and Hélène Saint-Marie, Advanced Wound Care Advisor. So the team engaged in several discussions to determine what the pandemic meant in terms of education, using a strengths, weakness, opportunity and threat approach. Certainly the beliefs and behaviours of Estheti as an organisation supported the fundamentals behind driving a change and a shift, as well as learnings and insights from the medical side of our business. If we look closely at this approach, we can see the obvious strengths and opportunities. We have a strong customer base, existing educational platforms such as online modules and paper-based materials, technology to reach our audiences, strong relationships and partnerships, and an ethical and moral approach to our business. We knew this would also be a positive change with the ability to reach a broader audience with an efficient approach to training, followed by accessible recordings to support customer needs. And then, when we consider the weaknesses or the challenges, we determine them through a long-term care lens or a long-term care perspective. So, for example, they had to be relevant and meaningful to the pandemic. They had to be short and time sensitive in terms of reaching a maximum audience across the country in multiple time zones. They also had to be easy, structured, and directed to specific audiences where they would be applied in practice and have immediate benefit and impact. To a certain degree, the pandemic itself was fundamentally the threat, in as much as it was and is also an opportunity. I think we have witnessed this throughout the year, as across the globe we have creatively designed new ways of working. The pandemic is fast-moving, the trajectory is unknown. What is also unknown is the concept of education delivery, and if it would add benefit or create engagement. However, all these negatives have been overcome through the very nature of the pandemic itself. So having determined the need, the team began to determine the relevant materials through focusing on the why and the purpose. So let's review the why this change was required. So we'd already established the rationale was fundamental to our beliefs and behaviours at Estheti, as well as education delivery in the traditional sense is fundamental to our value-added service. So again, looking through the lens from a long-term care perspective, we recognised it was increasingly difficult to provide basic care. There was an increased call for superabsorbent product, a need for fast, reliable processes, a need for safe, efficient processes that reduce risk and exposure, and a requirement to equip the learners with skill sets required to provide continence care. So it's important to be mindful that much of this work happened simultaneously. Establishing needs allowed us to determine the target audiences, which led us to think in terms of who might benefit the most. This was fundamental, forming the foundation of Estheti's aim to support crisis management in BC long-term care homes and nationally for continence care provision, specifically where direct care providers were not necessarily those accustomed to the role. And this in turn led us to think about the series of webinars to support different audiences, as we recognise that not all audiences would benefit from each specific focus. The series of several webinars addressed several audiences, as we realised different needs were relevant to different individuals. So this example demonstrates a slide from the first webinar, where we address the audience directly, highlighting who might benefit. The theme of highlighting who might benefit continued throughout. In this example, the target audience included anyone already providing care that would like to refresh their knowledge, care providers that were returning to practice in the pandemic, care providers that have not previously been involved in that scope of practice. So, for example, OTs, physios, physicians, and activation staff. The simultaneous identification of need and audience also enabled identification of the focus with a review of existing materials within our portfolio. And this included many materials that many of you may already be familiar. So, for example, TENA YouTube videos, TENA U modules housed within our customer-based TENA Net, and the TENA StepbyStep Toolkit, just to name a few. And as well as that, the newly developed continence care module and video developed in collaboration with Conestoga College in Ontario as part of a 5-year collaborative led by Dr. Veronique Boscart. Dr. Boscart is the Executive Director of the Schlegel Centre for Advancing Seniors Care and Canadian Institutes for Health Research. So when reviewing the portfolio, we also determined priorities and content, and this included incontinence products as a priority, where we would address infection control practices related to continence care, correct product fitting and sizing, specifically briefs as a starting point, correct application of briefs, and then do's and don'ts, including double padding and an explanation of associated risks in practice. And then this was followed by skin care, again addressing infection control practices as they relate to continence care, information about the function of the skin and importance of maintaining the proper pH of skin, the importance of using a product that is pH balanced and formulated to be gentle on the skin as opposed to soap and water, aging skin, incontinence related skin damage, and the importance of skin cleansing at every incontinence product change. So all information gathered then began the build out and adapting. It's notable that while broken into slides for the purpose of this presentation, the entire process happened extremely quickly, and some of it, as I've already mentioned, simultaneously. However, regardless, the internal team was flexible in adapting to meetings across multiple time zones to ensure we reached consensus and were able to meet timelines. So the collaborative resulted in the series of webinars to address the challenges of continence care needs for our customers and residents. And these included TENA Stretch Brief application, perineal care, and inventory management. This slide demonstrates the invitation to the webinar series, where respondents could attend all 3 in the series or mix and match. The upcoming slides review the TENA Stretch Brief application webinar to offer you some context to the overall series, as well as content and how the Conestoga College Collaborative supported this. So we can see how the webinars were intentionally short and consisted of approximately 10 to 15 slides each. They highlighted small pertinent pockets of information. The first in the series, as I mentioned, was the Stretch Brief application, and it aimed to review those areas shown here on the agenda slide. So benefits and purpose, the Stretch Brief assessment and sizing, and the TENA Stretch Brief application, and then helpful do's and don'ts. So addressing the audience directly and highlighting who might benefit, as I mentioned earlier, was a theme throughout, aiming to encourage relevant participation, as we had recognized that not all audiences would be the same. Each digital invitation highlighted the target audience as well as who might benefit, so that customers could prepare who they might consider attending. Each webinar also offered purpose and expected outcomes. So as an example, the purpose of the Stretch Brief application webinar is highlighted here. The short webinar aims to provide the learner with a basic understanding of continence care practices during COVID-19 by ensuring the safe, effective use of TENA products, offering a practical and efficient approach to ensure effective support of clients, equipping learners with skills and confidence to utilize TENA products effectively, highlighting that correctly assessed sized briefs, products offer efficiencies and are less likely to leak and cause skin issues and repeated changes, and also to offer understanding of infection prevention practices as it relates to continence care. So following the short introduction, the remaining slides address the efficacy of the product, the points spoken to by reviewing size, fit, and application. So to elaborate, a correct fit is vital to ensuring there is no leakage. Incorrectly fitted products have a tendency to leak and cause skin-related issues, as urine and stool will get onto the skin. The TENA products are designed to absorb urine quickly and effectively, and the better the fit, the more readily they are able to effectively do this. Frequently having to change a product because of incorrect application and leakage leads to greater exposure to the contents of the product and therefore infection-related concerns. And importantly, we also added the written instruction and recommendations on each slide, followed by where to access these materials. And in most cases, this is the TENA Step-by-Step Toolkit. So within the series, each presentation contained a video to support the message and the learning. The partnership with Conestoga College is particularly important. At this point, as in the webinars in the series, the video that supports the collaboratively developed educational module was embedded in the webinars. We can now take a moment to review the supporting video that supports the module. The video and module are detailed, highlighting a person-centered approach to care delivery, with specific attention to the importance of care planning, individual needs, and individual awareness. Video.
Charlie needs assistance using the toilet every morning before breakfast. As he requires 2 people to assist him, Jenny asks Doug, another care provider, for help. She performs hand hygiene and collects the items she will need to provide continence care before asking Charlie if she can enter his room.
Charlie, can we come in?
Incontinence is a sensitive situation for any resident, so it requires a person-centered approach. Jenny engages in conversation with Charlie.
How are you doing today, Charlie?
Before asking if he needs assistance to use the toilet. As a care provider, you should ask the resident if they need assistance before you provide continence care. Jenny walks to the bathroom with the supplies she needs, turns on the light, and turns on the tap. She wets the washcloth with warm water, performs hand hygiene, and puts on her gloves. The bathroom is now ready for continence care. With confirmation from Charlie that he's ready, Doug and Jenny help Charlie enter the bathroom. Doug positions Charlie in front of the toilet. To ensure resident safety, it's important to lock the wheelchair into place before assisting the resident to stand up. Doug performs hand hygiene and puts on clean gloves before he and Jenny come to stand on either side of Charlie.
And that is what you're going to use to push yourself up.
Jenny provides Charlie with clear instructions on how to stand up. She asks Charlie to sit upright in his chair, push down with his hands on the armrests, and down with his feet on the floor. On the count of 3, they assist Charlie to stand. Jenny asks Charlie to turn towards her. Charlie pivots while Doug and Jenny support him to transfer safely. Working together as a team, they successfully transfer Charlie into a safe position for continence care. Now that he's standing, Jenny and Doug can remove his continence product. Charlie lowers his pants and they undo the tab on the side that is closest to them. Jenny removes the brief, rolls it up, fastens its tabs, and discards it according to the infection control policy. To ensure resident safety, assure that the resident's legs are touching the toilet before they sit down. Once seated, encourage the resident to empty their bladder and bowel. To preserve resident dignity, provide privacy to the resident. If leaving the bathroom, provide the resident with a call bell for safety. The level of privacy provided is informed by the resident's care plan, risk of falls, and your observations of the resident's cognition and function that day. When the resident is done, ask to re-enter the bathroom and/or remove and discard the towel. Doug and Jenny walk to stand on either side of the toilet, and Jenny provides Charlie with clear instructions on how to stand up. On the count of 3, they assist him to stand. With Charlie standing, Jenny explains to Charlie that she will now perform pericare. For circumcised males, wash the penile region in a circular motion from the urethra to the bottom of the shaft. For females, wash the vaginal region in a downward stroke from the vagina to the anus. Jenny discards the soil washcloth according to the infection control policy before drying the area and discarding the soiled towel. Now it's time to apply a clean brief. While still supporting the resident, explain what you're about to do. Stretch the brief out and fold it lengthwise. Place the brief between the resident's legs from front to back. Fan out the back of the brief and smoothen it against the resident's body. Do the same for the front. Bring the brief side panels around to the front and rub the hook tabs down. Gently tug the tabs to make sure they're secure. Adjust the brief by pulling the inner thigh folds down and fitting the brief into the resident's groin. Assure the resident is comfortable and with his or her confirmation, raise their pants. After providing continence care, you should always perform hand hygiene and change your gloves. Now it's time to get Charlie back into his wheelchair. Jenny asks Charlie to turn towards his left. He pivots toward her while Doug and Jenny support him to transfer safely. To ensure resident safety, assure that their legs are touching the wheelchair before they sit down. Charlie puts his hands on the armrest and lowers himself down into the wheelchair. Jenny and Doug remove and place their gloves into the garbage before performing hand hygiene and offer to help Charlie wash his hands. Finally, Jenny checks to make sure Charlie is comfortable.
Are you feeling comfortable there, Charlie?
While Doug helps Charlie leave the room, Jenny cleans the bathroom. Not only is the resident's health and safety a priority, but so is Jenny and Doug's. When they're finished, Jenny performs hand hygiene and makes a note in Charlie's chart that continence care was provided. She also documents any relevant observations. For example, this morning, Charlie's brief was soiled. Ongoing review of Charlie's care plan is important to ensure person-centered care is provided.
So I hope you enjoyed the video. You can learn more about the module by visiting the Estheti booth or talking to your local account manager. So prior to the close of the webinar, there was an opportunity for questions. Attention was drawn to the significance of the available resources and the literature to support the recommended care practice. This particular webinar specifically addressed best practice of the use of TENA absorbent products and the challenges that may arise from incorrect application, fit, and double padding. We took the opportunity to share key takeaways, important do's and don'ts, followed by advising attendees on where and how to access these essential resources, as I've already mentioned. And as I mentioned earlier, the TENA Step-by-Step Toolkit offers a resource for housing these materials. So as well as the open opportunity for questions, the platform allowed us to record and loop back with further questions and options for feedback and details and feedback and details if the attendee requested. If for any unforeseen circumstance an individual was not able to attend, providing they had registered for the webinar, they could access the recording. And this slide just demonstrates the other webinars in the series. As I mentioned earlier, the webinars may have been relevant to different audiences. So while the perineal care webinar may have been relevant to a similar audience as the Stretch Brief application webinar, the inventory management webinar may have been more appropriate to those accountable for stock levels and ordering, although of course every team member has a responsibility for the use of valuable resources. This particular webinar did, however, offer managers and inventory controllers a review of the TENA Excel tool, a specific tool outlined in step 3 of the Step-by-Step Toolkit, offering an ordering process that reflects product quantities and type that are reflective of client needs at a specific given time, rather than a standing order approach. So what about the future and moving forward? Well, certainly, while there have been some very tentative visits into a few long-term care homes, the way we support our customers has changed forever, particularly in the long-term care environment. In relation to the webinar series, we are building capacity through ensuring the ongoing rollout of recordings across BC and Canada, 6-week follow-up to determine and address related challenges, repeating presentations as they're required, including at local levels with fine detail to support specific needs, reviewing improvement in continence care outcomes through our usage reports and our product mix measurements. These are highlighted in our internal reporting systems and locally agreed KPIs. And finally, integrating partnerships, ensuring components are embedded in the Conestoga College online module for unregulated care providers. In addition, we have also developed and built out a suite of internal resources to support local representatives in supporting their existing and new customers. The suite of resources assists the new virtual way of working. So, for example, the traditional materials to support a conversion to TENA have been redeveloped to support that same process from a distance, allowing the same detailed collaboration and customized attention to specifics. And these materials are also embedded in the TENA Step-by-Step Toolkit. So the TENA Step-by-Step Toolkit is a 4-step process for improving continence care practice through a collaborative approach. It is a resource that offers a specific approach to continence care. And this includes building a continence care team with shared responsibilities, assessing residents' continence care needs through the continence assessment and the product assessment, supporting efficient inventory management processes, and then finally, evaluation and audits to ensure success and/or change process depending on outcomes. And certainly if anyone attending today is looking for more information, we can share this with you, but it is available from your local account manager, both in hard copy and interactively. The interactive version is particularly useful as it allows you to access directly your local legislation. So it does, the toolkit does support capacity building through that process-driven approach. Everything that you need to start a continence care program is within the kit. There is a mutually agreed sign-off form within the kit to support collaborative work with your local account manager in identifying goals and working towards them, as well as that interactive map that allows you to access your local provincial legislation. So what about future implications? What does that look like? So as we look to the future, the fundamentals that drive Estheti business practices have not changed. Our goal is always to ensure our customers receive quality products and service. Specifically, the webinar series addressed adsorbent and skincare products, as well as the inventory management process. However, the fundamental tools that underpin the series are key to ensuring effective continence care strategies and approach. This presentation has highlighted a few of these, and of course, how we have adapted and adopted these so that they reach our valued customers. The underlying key message for practice is we aim to improve continence care outcomes through the learning of key competencies and skills, including that infection prevention practices, encouraging the safe use of TENA products, encouraging the skills and confidence to use our products effectively, encouraging understanding that correctly assessed and sized products offer efficiencies that positively impact the environment, client outcomes, staff satisfaction and budget. In addition, the collaborative partnerships are fundamental to positive practice outcomes. So for example, as I mentioned earlier, components of that short learnings are embedded in the collaborative project led by Dr. Boscart. A quote from Dr. Boscart in the recent press release is highlighted here. I encourage everyone to look at the online module and consider sharing it with team members who could benefit from this education. This module is a great way to learn about best and promising practices in continence care using real-life scenarios in an online format. In addition to this initiative, Estheti and Conestoga, the initiative with Estheti and Conestoga, further collaboration with the Ontario Long-Term Care Association has facilitated the upload of the online module to the OLTCA's Link to Long-Term Care site, a platform for association members to access relevant training, education and support. The module is also available through TENA U, Estheti's online learning platform, and we are currently working to broaden the partnerships with new college partnerships. So that brings us to the end of the presentation, Managing Incontinence During COVID-19. I hope that this has been informative, and I welcome to receive any questions regarding the presentation, the short webinar series, or the Conestoga partnership.